Okay, so in this video we're going to show the surface anatomy of the basic venous system of the upper limb, basically the superficial system. So the most common site for cannulation usually is the back of the hand, which is the dorsum venous network. This is usually forms with an arch. These veins here are the most commonly used. It's not very convenient for the patient to have the cannula in, but it's the best place normally because it's avoiding getting into the veins are bigger and further proximal in the arm, when then they are more useful for venous access for dialysis in patients with chronic renal disease. And at the base of the right thumb here, you see the arch continuing to the base of the right thumb, and then at this stage it starts to form the beginning of the cephalic vein. The cephalic vein runs here just behind the base of the thumb and runs on the outer aspect of the distal arm on the radius bone, and moving the hand to this position, you can feel the radial artery very close to here. The radial artery normally is deeper structure compared to the cephalic vein, but some people try to cannulate veins, superficial veins in this area, and if anyone is going to do this, you have to be very careful to avoid cannulating the artery. On the other side of the hand, there is the radial ulnar artery, which is a lot deeper and is very unlikely to be caught into a venous cannulation. On the outer aspect of the radial side of the arm, there is the cephalic vein, which is, you can see running across here. It's a very good vein for cannulating, but it's a very important vein used for AV fistula formation for a patient with renal dialysis. So it's very important to have a history from the patient to find out what is the underlying pathology and what's the underlying chronic medical condition. Because if you're going to cannulate a patient who is a chronic kidney disease, you would like to reserve these veins because it might be used for vascular access for dialysis. Otherwise, this vein is very commonly used for anesthetic, by anesthetic doctors to have cannulas pre-induction for anesthesia. So the cephalic vein carries its course on the outer aspect of the forearm and the arm, and it gives this is the cephalic vein at the antecubital fossa, and it gives this appearance of the cephalic vein on the arm. And the antecubital fossa, it's important to understand the anatomy of the venous structures because it's very close to the brachial artery. The longitudinal vein here is the cephalic vein. This diagonal vein is the median cubital vein, and it runs very close to the brachial artery. So it's very important to feel the pulse and identify the anatomy of the brachial artery. And when you're putting in cannula in this structure, you have to be very careful to avoiding cannulating brachial artery. Sometimes in a old thin patients, you can see the brachial artery pulsating, and sometimes people put a cannula in it, considering it as a vein. On the other side of the arm, you can see the basilic vein is forming into in the forearm, and is connecting the median cubital vein. And at this stage, just before it goes into the arm, it goes in deeper to the fascia and becomes the basilic vein into the fascia, under the fascia in the arm. It's unusual to see this vein because it's deeper and it's under the fascia in this stage, and it's very commonly used for inserting of peripherally inserted central lines like PICC line, mid lines, and smart lines.